Smile big. What do you think?
I love it.
You love it?
The moment when someone sees their new smile for the first time. Restoring form and function can change how you feel about yourself and even the foods you can eat. Some of our studio guests today know what that feeling is like thanks to our next guest. He's helped all of them to fix their specific issues with their teeth. Dr. Ali Obeidi, or Dr. O as patients call him, with Elite Dental Specialist, joins us with two other patients, Cecilia Ripple and Kim Goff. Kim gets a lot of attention this time of year. Can you guess why? All right, Kim, we were talking in the green room. I said, do kids come up to you all the time? You go, it's not the kids.
Not the kids, it's the parents who usually come up and ask me if I want a job to come and play Santa for them and their kids and stuff like that.
And you can have a good side job this time of year, but they also come up to you and say, listen, my child's been misbehaving.
Correct. And that's when I go over and talk to the child and say, hey, I'm watching you. and that's when they ask if the beard is real, and I say, yeah, touch it.
Yeah.
So they get a chance to touch it. And, oh, it's Santa's beard, Santa's beard. And, or they'll say it's real, it's real.
Yeah.
So.
All right. We're going to talk about some real teeth now in a minute. All right, Dr. O, there's dentist and then there are specialists. It takes more to be a specialist because you're doing all kinds of things. And technology-wise, you've been in the business long enough to see major changes. No longer are you relegated to just bridge work and dentures.
Mm-hmm. Yeah. As a prosthodontist, we trained 3-4 years beyond dental school. We are able to tackle complex cases, and with the new technologies these days, advanced imaging, printers, milling machines, better materials, we can fix almost any problem that people come up with fix, with not removable, with implants these days.
Yeah, and the great thing about that, all those things that you mentioned basically speak to how detailed you can get, which means it's not a one-size-fits-all. You look at every individual in their specific case.
Exactly, every individual. We don't do a fixed treatment fit everyone. Yeah. We customize the treatment for each individual, make everything fit to your need, face, based on the aesthetic that you need, reconstruct the function, reconstruct the aesthetic.
And it can be one tooth or all your teeth.
Yes, and reconstruct actually the confidence in you.
Yeah, all right. Cecilia, you had years of dental problems and that patchwork that we talk about. Can you explain to people just the frustration you go through, because it really does impact your self-esteem?
You don't know who to go to and nobody that you can contact to say, okay, who's the best dentist in Houston? Yeah. Who does something special? Because I have a special mouth that needs a lot of help.
Yeah, and you actually prayed for a sign and something happened.
Yes, I did. I gotten to the point where the consultations were just telling me it's too complicated to do, or we just can't do it.
You're turned away by
turned away. So as I was sitting there one day, I said to myself, you know what, I'm not giving up. And I said, Lord, I looked up and I said, Lord, help me, show me something, give me an idea of what I need to do. And then I forgot about it, I went on. Well, it was just amazing what happened after that.
What happened?
What happened was I happened to be scrolling on my phone and I ran across a video of Deborah Duncan from Great Day Houston. Yeah. And I said, wait a minute, because usually you have a lot of people on that have services they offer, and you always help somebody do something.
Yeah.
And I said, well, maybe she'll have a dentist on her, maybe she'll have an idea of maybe where I can go. And at that time, I'm watching this video, and it's Dr. O, and he starts talking, and I'm going, wow. And he even said he's a prosthodontist.
Yeah.
And I said, what's that? And then he goes on to explain what it is.
Yeah, because you realized that was the specialist that you needed to begin with, somebody who wasn't turning you away but bringing you in. And there's something else I want to touch on. A lot of times when you've been through this journey, you feel embarrassed, you feel like you're just fed up, you don't feel hopeful. The minute you walked in his office, you got emotional.
I did, because they treated me like I was somebody special. And it still chokes me up, because that's how they treat me every day that I go there, But I knew it was a sign, and I knew I had found the answer.
Yeah.
And I never looked back.
And Dr. O, there's all kinds of reasons why our teeth will start to fail. A lot of it is just age. We are outliving our teeth today. They really most of them weren't made to stay in there forever, but you have to do a lot of upkeep, and a lot of us don't keep up with that. But as she mentioned, she had had problems with her teeth for many years. So what was going on in her mouth, and how did you fix it?
So for complex cases like CL, bite problem, sustained infection, jaw collapse or bite collapse, things like that. And she came in with underlying medical condition that we even didn't know about it. So for kind of these cases, as a prosthodontist, we are trained to tackle and to plan. The most important thing and the limit is not the age. The limit is how you can plan it correctly. Right. So once we find out that she has fluctuating high blood pressure, and because this is an elective surgery, we needed to fix that one. So I sent her back to a cardiologist to fix that problem. She didn't even know about that problem. Yeah. And then we fixed that problem. She came back, and then we planned for a new reconstruction. The whole thing changed in her mouth. The function, she can smile better, she can chew better. Now she's
like, I can eat
now she's healthier. Yeah, of course.
Yeah. And a lot of people are healthier because they're not relegated to soft, starchy foods anymore.
Exactly.
They can have a more balanced diet. All right, Kim, you had jaw surgery in the early 30s, and sometimes when people have surgeries, it causes trauma to the mouth. But you had that in your early 30s, and it caused nerve damage. And so, what was happening with your teeth over the years?
Well, I had great looking teeth, and go to the dentist, and over time, all of a sudden they're starting to say something's wrong with your teeth. They don't look right on the inside. And what had happened is they killed all the nerves in my jaw. So if there was something wrong with my tooth, I never would know about it because I didn't have a pain.
Yeah.
So eventually, I ended up having to wear dentures, which I really didn't want to do.
Yeah, and that was kind of a battle too,
That's
right?
a battle because you're stuck putting up with the goo and everything else you have to wear them properly. I've had them come out during a meal while I was eating, taking a bite, it come loose or whatever
and
else.
The other tough thing about dentures is that you still suffer bone loss along the way.
Exactly.
Right?
Dentures does not prevent the bone loss. Actually, in some studies shows that dentures accelerate the bone loss.
Yeah.
So if you don't change the removable denture to a fixed appliance like all-on-4, like fixed implant-supported prosthesis, you're actually losing more bone during time.
Yeah. All right. So you were also frustrated trying
Correct.
to find the person who would tackle this case correctly.
Correct. I had a discussion with my dentist one day when I was in for an appointment. I said, is there a permanent way I can get rid of these dentures? And she goes, well, there's a doctor. Oh, you can go talk to him. We'll set you up with an appointment and talk to him. Maybe he can help you out. She didn't guarantee he could help me. He says, could possibly help me. Let him take a look at you. And I've been very happy ever since I met Dr. O. I mean, I went in, we sat down, we came up with a treatment plan. Everything was all set up, and then I came into another roadblock because about the time we were going to start all the procedures, COVID-19 hit.
Yeah.
So then everything went back on a hold, and it get frustrating, and then it came time, we were lifted to go see doctors again. I went and saw Dr. O, and we restarted all over from scratch again. But in the end, I'm very happy.
Yeah.
And
Dr. O, what stops a lot of people from even coming in is they're afraid of the cost. But you work with them. The most important thing is to have the knowledge of what's going on in your mouth to begin with. So when they come in, you say, please come in. Please sit down and talk to us.
Exactly.
And you also have the ability to match other people out there and say, look, let's see what they're trying to charge you, and we'll see what we can do.
Yes, exactly. So in our practice, we are working with several third-party financial institutes that they can help monthly payments, very, very competitive rates. And also, this is a private office. Yeah. There is no CEO. There is no big buildings. There is no cost
Some
related.
Corporation that you have to pay.
Corporation, exactly. So the patients pays what they pays for their treatment. They don't pay a CEO. They don't pay a big company or big corporation. So we can compete with other providers that are in corporation services.
Yeah. All right. What's the food you can eat now that you were missing before?
I can eat anything.
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 All right. And what were you missing, Kim?
I was missing, of all things, vegetables.
Well, no, I remember my mom, she said it's even hard to chew a salad. All right, what's the one thing you want to say to somebody at home who's putting it off?
If we can reach just one person looking for that help, don't waste any more time.
Yeah, or any more money with the patchwork,
Or any more
right?
money,
Right?
exactly.
Correct.
Kim?
Exactly.
Correct.
And Kim, what would you like to say?
And so
I would say, like Celia, don't put it off.
Yeah.
Go see Dr. O and talk to him. I mean, he's understanding, he's caring, he will give you the feeling that, hey, he really cares for you as a patient and just not a number or somebody else, you know.
Yeah, and you're not the only two that say that. Again, several people in our live studio audience this morning came in support of Dr. O, who they also feel the same way. They were some of the people you saw in the videos there where they were looking in the mirror for the first time going, oh my gosh, my teeth are finally what I was hoping that they could be. Sometimes for many people, it was the best teeth they've ever had in their entire life, right? And for others, it's restoring to what they used to have. So if you are tired of hiding your smile, hate your dentures, or you're struggling with constant dental problems, Elite Dental Specialist and Dr. O want to make a difference in your life and make sure it's done right. Call now to reserve a one-on-one consultation with Dr. O, which includes assessments and a complimentary 3D cone beam CT scan. That's a value of more than $450, but you can reserve your spot for just $45, and that $45 is fully refundable at your visit. You must mention Great Day Houston to receive this offer. Call Elite Dental Specialist at 346-603-5847. Again, that number is 346-603-5847. For more information, visit EliteDentalSpecialist.com. And stick around because the real Santa may show up later in the show because he's seeing some good work here.